Happy to be here. Can't see anybody, but I hope somebody's still left in the audience before dinner. My name is Florian. I'm heading Jameda. I'm trying to give you a brief overview of what we are doing and afterwards discussing how data can actually help in improving the relationship between doctors and patients. Actually, I was very interested in the conversation we heard before because it was also about data privacy, and our notion at Jameda is that data privacy is extremely important, but nevertheless, we feel that data privacy is also kind of an issue for the lucky, healthy ones. And the sicker you are, the severer your illness is, and the higher the probability that sharing data will improve your situation, the higher the chance that you're willing to interchange data. But that's just as an introduction. I hope I can manage that. Yeah, there's one big button. OK. So what is Jameda? You might not know that. Why are we there? Jameda is trying to help patients actually find the right doctor. So if you're ill, if you're sick, and you don't know which doctor to go to, if you moved into a new city and you want to know where you can go to, we offer exactly that. So you have a complete database of all the doctors. We have reviews of doctors written by other patients. We have very intelligent search that tells you which doctor to go to with a certain issue you have. So that's why we are out there. We're trying to help patients to find the right doctor. And we are doing that we try to be as integral as possible. So we try to not only help you find the doctor, but also to help you book an appointment with the doctor and see the doctor. How are we doing that? We have, as I said, a very sophisticated doctor search. We have developed a software that allows doctors to manage all their appointments with our software and actually to make these appointments public so that people can book the appointment online via the smartphone. And we have a subsidiary in Berlin, which is a company that offers telemedicine, so video consultations where doctors talk via their phone or their desktop PC directly with the patient. All of this has worked pretty well for us in the last year. So right now we are the biggest health portal in Germany. We have about 6 to 7 million patients that come to our site each month, so uniques. And yeah, we list each and every doctor in Germany. That's the last slide about ourselves. What's our vision and why are we maybe here today? We're trying to put digital into the relationship between doctors and patients. So we're trying to connect patients and doctors on a digital way and trying to revolutionize the sector because we feel that there's a lot of potential in actually improving the relationship doctors and patients have and improving the whole healthcare system by the means of digital. So that's our vision that actually drives our company forward. So, but now coming back to the title of this speech, and it has to do with the changing relationship between doctors and patients. So first of all, I'm trying to recap what we've already seen. So a lot of things have already changed that have an influence on the relationship between patients and doctors. Very brief, we have introduced, I'm a little proud of that, Jameda was established in 2007. We were the first ones in Germany, so we have introduced the search online for doctors. So what was the case before? You were probably more or less stuck to your doctor your whole life because it was very dure and very difficult to find a new doctor because you had no transparency. So doctor listings online help to bring transparency into the market and make people aware of all the doctors that are out there, all the specialists for my disease. The second one is online appointment booking, of course. This has also changed the relationship between doctors and patients. Why? Nowadays, I can just open my smartphone and say, is any doctor available next week within 10 kilometers of my home? And if yes, I might go there instead of my regular doctor, so less loyalty, more fluctuation among patients, and also more specialization among doctors. Third one is telemedicine. Of course, it is more convenient to sit at your home and talk to your doctor than sitting in a waiting room with 20 other patients. This is also changing the way we interact with doctors. And the last one is also obvious, and we are talking a little bit more about this in the next step, is availability of data. So the electronic health record in other countries is also a big thing. In Germany, due to data privacy issues, is still in its infancy. But it's pretty obvious that it's neat to have all your patient data on your smartphone when you go to a new doctor and not on a CD or in the desk of the doctor. So this is already happening, and it already changed the relationship. To sum it up, from my point of view, what has changed? We have more transparency, and that led to less loyalty. By the way, can you hear me? Yes. Okay. It sounded subtly as the microphone would switch on. No, okay. Good. So more transparency, a little less loyalty among patients because it's easier to choose between different doctors. We also see more competition among the doctors because if patients can choose deliberately which doctor they go to, doctors suddenly see themselves in a competitive surrounding, at least in the cities and the metropolitan areas. So they have to find a way to position themselves, specialize themselves, so that they can attract still new patients. We see a higher degree of service orientation. Of course, if there's more competition, if there's less loyalty, you have to be more service-oriented. And digitalization is right now starting to become a competitive factor in the healthcare sector. So this is everything we have seen already, and now I'm trying to discuss with you what will be happening in the future and what role can data actually play in that future. So what's currently evolving? Unfortunately, I haven't been here the whole day, so maybe some things are redundant because that's exactly what you've seen the whole day. But what we are seeing, sorry for not having translated all those things to English, I was too lazy. But what this slide should tell you is that right now we are seeing that there are a lot of not only wearables, but also sensors that actually empower your phone to do things that formerly in former days only doctors could do. So you have an ECG, you have ultrasound, you have blood pressure, pulse, the temperature, whatever. You can already measure that with easy plug-in extensions to your smartphone or with wearables. So the amount of data we are currently collecting about our well-being, our health, has nothing to do with the amount of data we were collecting a few years ago. So we're building up a massive source of data. The Astro skin I found very nice. I don't know if this has been presented here today as well. It's actually from Canada. That's what I haven't memorized that word. The Canadian Aerospace, whatever institute, is giving actually astronauts while they're training and when they're going up to space, because it constantly measures your blood pressure, body function, vital functions, your heartbeat, oxygen level in your blood, whatever. So the thing behind it is that's not only relevant for astronauts, but of course this is also very interesting for doctors, for patients, especially for patients maybe in remote areas, old patients that cannot go to the doctor every day, that have a severe illness and that need to be monitored. So maybe the basic message here is data can be collected, data will be collected. Now the question is, how do we make sense of all the data and how do doctors work with it? And can we actually improve something, not only in the relationship between doctors and patients, but also for society as a whole? And I think one very interesting thought about this is that if we are thinking about bringing all these data in an anonymized way to some kind of cloud, all this data is becoming extremely powerful. Why? Because it opens the door to personalized medicine. Right now, if I'm a doctor and I have a patient and he's sick, I can only say, okay, you're a man, you're maybe 40 years old, try this medicine. It would most probably work because it works on most people. What could be the future? If more and more people are willing to share their data in a cloud, and if AI, if artificial intelligence is actually able to access that data, as I said, on an anonymous basis, then of course we can tell quite fascinating things. Actually, this medicine works for men better than for women. This actually works if men exercise, work out, or if they sleep at least 8 hours a day. We know about potential risk with taking other drugs at the same time. So if we think of a future where people are willing to share that data, we're also talking about much more effective and efficient medicine, because we can actually tailor medicine to the individual need of somebody, because a large amount of data allows us to know about cause and effects in very, very specific segments. So society at large will benefit, but also the doctor himself will benefit. Why? Because he knows how to treat the patient well. He knows who exactly he's talking to. And because of the data and because of the assistance, the virtual assistant of AI, he can, during his talk to the patient, he can tell him what is his individual therapy. And yes, that's probably exactly what you've seen here all day. For patient, it becomes more and more convenient to share that data because everybody's collecting data just during his everyday life with his watch, shirt, whatever. So another thing that is actually changing the relationship between doctors and patients is the whole point of diagnosis. I don't know if you've heard about, there are different startups out there. In Germany, currently the most prominent one is called Ada Health. What they developed is a huge database of the most frequent illnesses and an algorithm that actually sits on that data and that can determine by means of certain questions and by means of analyzing the answers to your questions what your illness is. So diagnosis. In former days, this has been one of the core competences of the doctor. In the future, it most probably won't be the core competence of a doctor because systems, machines will be based on pattern recognition, much more able and much better in actually determining what you have. So this is a very simple example. It's a chatbot. Hello, Peter, how can I help you? He says running nose and a headache. And yes, machine understands it. How long have you had the symptoms for? Do you also have one of the other symptoms? Dry cough, shivering, high temperature, muscle ache, whatever. This is very simple, but the system is also already very sophisticated. So it will help us in answering very decisive questions about the diagnosis. And this is also very important for what happens when I come to the practice. Because if I'm a doctor and beforehand, for example, if it's one of our doctors, and he can send these questions, some patient books an appointment via our site, we know he's going to the doctor, and the doctor can send those questions in a chatbot to the patients before he comes to the practice. He probably saves the first 2, 3, 4 minutes of the treatment because the patient comes to the practice and the doctor already knows about his condition, and he also has a very good judgment of and the probability of what kind of illness he has. So if we have the data and if we have the diagnosis, the question is, how else can actually data and artificial intelligence help the doctor changing the relationship? And of course, there will be a lot of virtual assistants because dealing with data, looking at the pictures, looking into results of a laboratory with your blood values of, I don't know what the heck the English word for it, as looking at your blood values, whatever, that's nothing a doctor should actually be concerned with because a machine can do that a lot better. Because a machine it's much quicker and can consider vast amounts of data that the doctor cannot. So there will be virtual assistants who will talk to the doctor or the patients during his talk to the patient, because the assistants can do a lot of stuff that the doctor can do but doesn't necessarily have to do, freeing up time for the patient. And the last example that's also interesting because it will change everything that happens after the appointment the patient has with the doctor, because we're already seeing that technology is changing the way we are thinking about therapy. So this is one example. I don't know if you've heard of it. Tinitrex has been one of the first apps that has actually been officially licensed as a therapy. So it's a medicine in Germany right now. If you suffer from tinnitus, whatever that is in English, if you have a beep in your ear the whole time, then you can download an app. And this app is actually offering a therapy because it goes through your library of music on your smartphone, it picks the tracks that will actually help you, and it modifies the sound of the tracks, so you hear the whole time music you like, slightly modified, and this will actually better your condition. It increases not only the perceived condition, but it actually is a therapy to tinnitus. So I think that's a pretty neat example of technology, which helps getting people making people feel better, getting people healthy, and it's very easy and convenient to use. Okay. So to sum it up, what's probably the evolution of the current relationship between doctors and patients in the next years we will see. First of all, from my point of view, efficiency and effectiveness, of course, of a treatment will be dramatically increased. Why? As I said before, we can use pattern recognition, artificial intelligence to actually determine what you have and define the best therapy. Personalized medicine will probably also be enabled by the vast amount of data we have and collect maybe in the cloud. It will take a while, but it will be possible to actually say, hey, if I modify this medication slightly for you, it will have a much better effect on you. This will also dramatically improve health outcomes. As I said before, we will also see a shift in the core competencies of doctors, because right now he's looking a lot at data. He's trying to figure out from the radiologist and pictures, trying to make sense of it. He won't do that anymore. He doesn't have to deal so much with diagnosis, but he will actually help the help the patient making sense of all the data that's out there, categorizing, classifying, and coaching the patient. And that's the last thing. It's probably a different perception of the role that the doctor has, away from the almighty doctor that does everything, that's untouchable, more to a personal health coach, somebody who's actually there to assist you, who's guiding you through all the different data that's out there and helping you making sense of it and hopefully helping you to be better off with respect to your health. I have 18 seconds left, but unfortunately I'm at the end, so I will only thank you for your attention, and I don't know if it's allowed to ask questions or is it whatever. If you have questions right now or afterwards, I'm still around. Thank you very much.